From Nevada Public Radio, I'm Joe Shaneman. It's State of Nevada.
And I'm Amber Renee Dixon, host of Nevada Week on Vegas PBS. And today, KNPR and Vegas PBS are collaborating as we look back 5 years to the start of the COVID-19 pandemic. You can listen here on your radio or online, or go to vegaspbs.org where you can watch the show, see Joe in person right now.
I don't know if you want to do that, but it was March 12th, 2020, when Governor Steve Sisolak announced a state of emergency in response to growing infections and deaths from COVID throughout the state. 5 days later, he announced a statewide business shutdown, and something no one ever thought would happen happened. The Strip shut down for 78 days.
And Nevada kids transitioned to distance learning for nearly a year. 5 years later, Nevadans are still feeling the impacts that the pandemic left on our state. Some suffer from long COVID, others from mental health struggles. Students are still catching up academically and socially. Our economy was hit hard and is still coming back, and there were the many people who passed away. The Centers for Disease Control and Prevention reports that more than 12,000 Nevadans died from COVID. We want to know how COVID impacted you. Please call or email with your comments or questions. The number is 702-258-3552. Again, 702-258-3552.
And you can email son@knpr.org. That's son@knpr.org. And our panel of guests today include many you came to know during the pandemic as sources of reliable information here on State of Nevada or Vegas PBS. We have Brian Labus. He's an assistant professor of epidemiology and biostatistics at UNLV. Andrew Woods, director of UNLV's Center for Business and Economic Research. Megan Rauch Griffard, professor of educational policy at UNLV. And Dan Ficalora, clinical director at Bridge Counseling Services. Everybody, welcome to the program.
Thanks for having us.
There's a lot to fit in, but let's start with Brian Labus and the current state of COVID-19. A novel virus in 2019. What's it look like in 2025?
We're still seeing the virus circulate. It hasn't gone away, but we're experiencing it very differently than we did 5 years ago because it's not a new virus anymore. People have immunity both from getting infected naturally and from the vaccine. And so that really changes the way that we interact with the virus. Because of that immunity, the death rates that we see are lower. We understand more about treatment. We understand more about prevention. So it's the same virus, but the way we interact with it is different these days, and we have a better understanding of how to protect ourselves. But people are still getting sick with COVID, and people are still dying from COVID.
So the severity of it, it's not as severe? Or how would you put it on a scale of 1 to 10 versus what it was like when it began in 2020?
It's hard to put a number on it. Basically, it depends who you are, and it depends on what your prior experience is and your underlying health conditions. People that have been repeatedly vaccinated or have had the disease have some immunity to it now. So even if they are exposed and they get sick, they're less likely to be hospitalized. They're less likely to die because it's not the first time we've ever been exposed to it. So the virus itself, like I said, hasn't changed. And there are some of the viruses circulating that are worse than that original strain we dealt with. But really, it's the fact that our population has some history with this virus now that gives us an advantage in dealing with it compared to where we were 5 years ago.
Yeah, I guess people understand it more. And we did ask people ahead of the show to call in, as we do every week for our Wednesday program, to call in and leave a voicemail, which we may or may not include on the program. And Gloria Farley of Logandale called our listener line, and she left this voicemail.
I'm a COVID widow. My husband, David Michael Farley, passed away from the COVID in November 10th, 2020. He was in the hospital for 2 weeks in Mesquite, and the other 40 days he was in the hospital in Las Vegas. And you never, ever really get over the suffering that you know they went through, sitting in the parking lot day after day and not being able to hold their hand or talk to them, and just hoping that they can text because they can barely breathe. So I don't believe everybody really realizes just what damage it did to a lot of families and how we still will grieve for the rest of our lives, not for ourselves, but for those who suffered so horribly. And all we can do is try to continue on with our life, but we'll never forget. And that is the story of COVID. And my husband got the COVID at the same time President Trump did. And it broke my heart when the president said that he beat COVID and it's not a big deal. And he threw his mask off. And I cried. I cried like a baby because it was a big deal to a lot of us. And this is our life from now on, is to always remember that COVID was real. And it pretty well destroyed a lot of lives. And that's my story. And if you ever want to read all the texts, I had them transcribed in a journal, and I wish they could go to the Library of Congress so people can remember that there was a lot of families who suffered horribly during the COVID pandemic. Thank you very much for listening to my story.
Gloria, thank you for leaving that message. Very, very sorry about your husband. Back in 2020 and 2021, Brian Labus, the public's understanding of it, what was that like from your perspective about how much the public really knew about this disease?
Well, it wasn't just the public that struggled to understand what was going on. It was scientists that had trouble understanding because we had to do the research to figure out what the virus was. It was brand new. We'd experienced coronaviruses before. We knew some things about them, but we also knew this was going to be different. And we didn't know all the details, and that was one of the challenges in trying to do something about it. If we don't know exactly what it is, we don't know how to stop it. And we kept learning things every day, and we would share that with the public, and the public would get frustrated with us because they would say, the information's changed every single day. Well, that's what science is. We're trying to learn about this virus. We can either stop learning or not tell you when we learn something, and neither of those are really good options. And so basically the public, alongside with the scientific community, learned what this virus was, and we had to change our response almost on a weekly basis because of the things that we learned.
Dan, I want to go to you now with Bridge Counseling Services, and when you hear a call like Gloria's, she lost her husband from COVID, what do you think?
The unimaginable grief and trauma that came from this experience on the individual level, but also as a society and as a culture, that collective trauma that we all experience, watching the death toll count on the evening news every night kind of tick up slowly. And, if we were going to create a lab experiment to figure out a way to increase anxiety and depression in a population, you would probably go with isolation and uncertainty and just turn up the volume on both of those. And that's exactly what happened during the pandemic. No one knew what was happening, and we were all isolated from each other. And that's the perfect recipe to increase substance abuse, depression, anxiety, self-harm, suicide. All of them went up during the pandemic.
And again, our number is 702-258-3552, 702-258-3552, or email son@knpr.org. And we just got this email from Patricia who said, I had my first baby in October of 2019 and had returned to work on the Strip in January of 2020. The shutdown made me a stay-at-home mom that was isolated from friends and family. I had an infant and suffered from postpartum depression. The stress of the pandemic amplified all my anxiety. I feel like I'm still working on my mental health and the impact the pandemic has had on my life. And again, Dan Ficalora, how many people do you still talk to that still have issues or are still talking about the PTSD or the stress or the depression that they incurred during the pandemic?
It's pretty constant, both in those clients that were with us pre and during the pandemic and those that have come to us afterwards. The effects of that time period of those couple of years that we were all dealing with this pandemic really impacted the collective psyche and mental health of the nation. There's a couple studies out there that said about 1 in 5 adults have identified that the pandemic negatively impacted their mental health. The World Health Organization said there was a collective 25% spike in anxiety and depression from 2020 to 2022. And we haven't gone back to pre-pandemic levels of anxiety and depression. It's still higher than it was pre-2020. So it's everywhere. And what we've been seeing most recently, a spike of people having to go back to work, going back to the office, that are just really anxious and people coming in for treatment and asking for, can I get a letter from my employer that's going to exempt me from going back to the office, because I really can't deal with going back to the office right now for a variety of personal reasons.
Megan Rauch Griffard, professor of educational policy at UNLV. We had spoke prior to this discussion on the phone, and you brought up the trauma that children have endured during the pandemic. What was that, and how does it continue to impact them today?
So for the kids, especially the kids in our state, going to school is an inherently social and developmentally important experience. And what we saw during the pandemic is, like my colleague was saying, those opportunities were lost. And when you have a young mind and a developing brain, it's super important to be able to interact with peers, to interact positively with adults, which is something that happens at school every day for kids. And so not having those things and also dealing with the stress of living through a pandemic is really scary and really hard. And when you don't necessarily have quite yet the developmental tools to process what you went through, we can see that manifest in schools today with certain behaviors that kids are displaying, or with chronic absenteeism, so students either not feeling comfortable coming to school or not feeling like school is a priority for them anymore. And so there's just a lot going on for young people today, 5 years later.
And why did you say particularly in Nevada?
I think what we saw in Nevada, which I'm sure my colleague with more expertise on the economy can talk about, is we are a service-driven economy, and so for a lot of families, it either meant that their income was lost or that they were still going back to work, in the early days after things started to reopen, in a very scary and uncertain environment, and worrying that your parent or your caregiver is going to get sick is something that's really, really scary for a young person to have to try to grapple with. And there's also the fear of losing your home or losing your job for your parents. And so food insecurity, home insecurity, all of those things are stressors that kids internalize and carry with them.
Again, our number 702-258-3552. This is a special program today. We're in collaboration with Vegas PBS and Nevada Week host Amber Renee Dixon sitting right next to me. We're talking about COVID 5 years later. How did it impact you? How did you get through it? How do you feel about it today, all this time later? It was a very scary time. Is it something that you still think about? Again, 702-258-3552 or email son@knpr.org. And Michael from Las Vegas is with us. He's a retired special ed teacher. Michael, welcome.
Hi there, Joe. How are you?
I'm doing good. Thank you. Go ahead.
Go ahead. Yes. I just want to give a perspective from, I taught special ed a long time, and I also am a teacher of transcendental meditation for 51 years. So COVID for me was really no big deal, because if you do your TM technique, and it's science-based technology, it's not just a technique of positive thinking, you strengthen the immune system. So at my age, and I'm pretty old, I caught it for 2 days, and it was over and done and finished. Yet I taught many, many doctors and nurses and kids that came to me and said, I can't get rid of this COVID. I've had it for months. You have to strengthen the immune system. And I don't see people saying that. They say, go get a shot and all that. That's up to the individual, of course. But and I went off to a country to help in a war-torn area, and I didn't wear a mask, and I just made sure I did my TM twice a day to get this deep, profound rest and create coherence in the brain. So I just wish people would think more in terms of that, to avoid all this suffering so much, to get the deep rest, to strengthen the immune system. So when COVID hits you, it's like a bad cold for 2 or 3 days, and you're over, and it's
Michael,
done.
thank you so much for that call. For some people, it actually was that. It was some people just had it for a couple of days, but as you heard from the voicemail we had earlier, some people didn't make it out of COVID. And there were, of course, people who would not get vaccinated, and people were trying all kinds of remedies. We received this voicemail from Brad Priotti, and he talks about some of the ways one of the ways he tried to get and actually believes that he did get through COVID with his own home remedy. And here's that voicemail.
I cured my COVID by eating minced garlic nightly, 1 tablespoon of garlic every night before bed, before I brushed my teeth. And my COVID was cured. The following day, I went snow skiing at a fabulous resort with no depreciating issues with any of my physical abilities.
Brian Labus, during COVID, we heard there were a lot of people were searching and struggling for ways to get through it. How do you improve your immunity? People said, my immunity is so strong, I don't need the vaccine. You just heard a caller talk about minced garlic, taking a teaspoon of that every night. I'm sure you heard a lot of those things. Were any of those home remedies things that had been researched that you'd known about that worked?
Unfortunately, no. If we had something as simple as taking garlic every night that would cure COVID, we would have recommended to everybody. There would have been a shortage of garlic. People would have been stocking up on garlic like they were bottled water and toilet paper earlier in the pandemic. Unfortunately, that doesn't work to treat a viral infection like that. And people's experience is very different. At one extreme, you have people with an asymptomatic infection where they never develop symptoms in the first place. And at the other extreme, like we heard the caller earlier, we have people that die from COVID. So it really comes down to your individual health, your immune function, all the things that you've been exposed to over the course of your life that led to where your health was at that point when you got COVID. And so there was really no one simple cure-all for this particular virus.
And Megan, you wanted to add to this?
I just wanted to acknowledge that I think the fear and anxiety that COVID created eroded some trust in some of our public systems. Like we've seen a lot of bad-mouthing in the press of scientists and public health officials, and also of teachers who are these folks who are doing their best problem solving on the fly during a very scary time.
Yeah.
Brian, what has that been like for you, being in this space and having that increased amount of critique? Or, I wonder about the hesitation about vaccines prior to COVID versus the hesitation now. How do they compare?
Well, vaccine hesitancy is an interesting issue. People become more afraid of the vaccine than they do of the disease, and they don't get vaccinated. That's exactly what we're seeing in West Texas right now. People are afraid of the measles vaccine more than they are the disease measles because they haven't seen measles in decades. With COVID, it's at the point now where this is something we've learned to live with. It's not the story on the news of how many people died in Southern Nevada today. This is something that we deal with every year like flu. And so people are more afraid of the vaccine than they are of the disease itself. The problem is the disease is way worse than any possible side effect from the vaccine. The vaccine is safe and effective. It keeps people from being hospitalized. It keeps them from dying. But that's not the side that people see. And so the result is this hesitancy to get vaccinated.
And personally, what has life been like for you?
Well, as an epidemiologist, for the first time in my career, people actually knew what I did, which was kind of interesting. So all my colleagues were finally in the public. We usually work behind the scenes. Nobody knows what's going on. So at first it was exciting. It was interesting because people looked to public health for advice. And then everybody turned against public health, and we became the bad guy. People were getting death threats. I haven't experienced anything like that personally, but I had a lot of colleagues who were receiving hate mail from the public, death threats, things like that. And so a lot of people just said, that's it, I'm done, and left the field because they were being targeted by the public. Essentially, instead of fighting the virus, we were fighting the people that were fighting the virus.
Yeah, joining us now is Marilyn Kirkpatrick. She is a Clark County Commissioner, and she was in that position during the pandemic. Marilyn, welcome to the program.
Good morning, and thank you for having me.
Yeah, thanks for being here. I wonder if you could talk about what it was like to be governing at the time when all of this was happening, especially in Clark County, in the Clark County Commission, which is arguably the most powerful legislative body in the state as it governs year-round. It's you meet every 2 weeks and you deal with issues in the largest county in the state.
Well, first of all, I would tell you it's probably the hardest thing that I've had to go through in my entire life, and I've been through some things. So, but really, it was pretty hard in the beginning, especially because we didn't know a lot of information, and we were getting mandates all the time to shut down, to use masks, not use masks, and there was a lot of uncertainty for folks. There was a lot of uncertainty for our first responders who were expected to be on the front lines, many of our public health agencies that stepped up. But I can tell you over time, we have really a lot to be proud of. We did a lot of great things during that time frame, but it was not easy. And I heard earlier that, there were death threats. There were protests at people's homes. There were people that were so nervous and so angst about it that they couldn't believe anything that we were saying or doing. But I think after the initial first, the month of it, when we had a little more information on it and we could start helping people get back on track, I think that for the next few years, it got a lot easier, and people just wanted to know how to navigate. So I would say it was one of the hardest things I did, probably one of the proudest moments, though, of our entire state coming together, working to write regulations that were endorsed by the Johns Hopkins University, thinking outside the box to get our kids so that they could, they gave up everything for the first time in their life. So whether it was with our seniors who were out and we were giving them food, but initially it was very, very hard, and it was a true testament to where government should have been at the front.
But when this started, politics became, I guess, really important in the minds of people who wanted vaccinations and those who didn't want vaccinations, or they didn't want to wear masks. There were protests on street corners in Las Vegas. We talked to a lot of people on this program about that. I wonder if you yourself, as a legislator and as somebody who, creates ordinances and approves them, if you got a lot of angry emails from people or phone calls blaming you for what was going on.
100%. I did. And, one of the things, realize there's a lot of people that put their own families aside to ensure that other families did well. And, there was one moment when I had a 4-hour protest at my house with strobe lights and cameras. My grandkids were scared to death about why they were so angry with us. But at the end of the day, we had a job and a responsibility to ensure that the majority of the people had the resources that they needed to navigate and to move forward.
And again, we are taking phone calls, and we have this one from Netta in Las Vegas, who says COVID made her become a foster parent. Welcome to the program, Netta.
Hi, thank you, David. First, I have to say I used to be the host for All Things Considered out of Hawaii Public Radio, so it's an honor to also be a guest here right now. Yeah, so I love it. I mean, I listen to the show constantly. But what happened with me, first of all, I don't want to demean anybody who passed away, and my condolences out to those families, and my, kudos to all the people who helped everybody who was going through it, whether it be politically or to first responders, to all of them. But for me, I've always wanted to be a foster mom. And because of what happened, Department of Family Services created an online training to allow people to become foster parents through the online training. And as a single person, I didn't want to drive all the way down to where the area is because it's, not very safe, and I'm a little scared to drive at night, and I didn't want to do the training at night. So this caused me to train and to become a foster parent, and as a result, I adopted one of my foster children. So I don't want to get emotional, but it made me be a mom, right? Wow. Something that I've always wanted to do, and I've helped about 13 foster kids since. So this is just a different perspective to share, because I know there's a lot of negativity, but and I don't want it to take away from what happened, because of course we're all learning and we're all growing, because at the end of the day, so powerful is the light of unity that it can illuminate the whole world. And if we can all unite by something like this, I think it's very crucial.
Thank you so much for that perspective and for contributing to our society in that way. We do have to take a break now, and we will be right back with State of Nevada.
Support for Nevada Public Radio comes from Comprehensive Cancer Centers, where our cancer genetic nurse practitioners are helping people determine their future cancer risk through genetic risk assessments. Learn more at cccnevada.com. And from the law firm of Dickinson Wright, handling real estate and business transactions for businesses from contracts and agreements to privilege licensing and business or real estate transactions. Information at dickinsonwright.com.
Support local news and culture with every purchase from the Nevada Public Radio online store. Explore exclusive merchandise like stylish mugs, cozy shirts, fun stickers, and so much more, all designed to celebrate your love for public radio. Every purchase helps fund the programs you depend on and keeps Nevada's stories alive on air. Shop now at knpr.org/shop.
I'm Robin Young. A new Yale program hopes to shed light on why female athletes suffer from some sports injuries more than their male counterparts and how to protect against them.
Girls and young women are more subject to ACL injuries than boys, and I think we can all think of famous players we admire like Megan Rapinoe who have torn their ACL.
Next time, Here and Now.
This morning beginning at 10 on KNPR and streaming online at knpr.org. Support for Nevada Public Radio comes from the Smith Center, presenting Storm Large Inside Voice, from ballads to rock. Storm shares songs by women songwriters. 2 shows on April 5th at Myron's. Information at thesmithcenter.com. And from California Closets, who believe every space in a home deserves a custom design solution. Personal design consultation booking at californiaclosets.com.
From Nevada Public Radio, I'm Joe Shaneman. It's State of Nevada, and this is a special program 5 years after COVID. We are doing it in collaboration with Vegas PBS and Nevada Week host Amber Renee Dixon. And we're looking for your insights, your questions, and your thoughts about how you got through COVID. And did it change your life? What's your life like today after having gone through that? Are you worried people forgot about what it was like, that they forgot the lessons from it? Give us a call. The number is 702-258-3552. That's 702-258-3552. You can also email son@knpr.org. That's son@knpr.org. And we asked people to call in before the program and leave voicemails, as we do for every Wednesday call-in show. And we have this testimonial from parent Elizabeth Galantomani in Summerlin.
Hey there, this is Elizabeth. I am a listener in Summerlin. I am a dental hygienist in town, and I think the thing that pulls at my heartstrings, and I can get emotional thinking about it, is listening to my patients who were losing their parents, and their elderly parents were dying alone without being able to see their family's faces or the comfort or touch of their family. As for my patients who were, when they started coming back, my performers, the ones on the strip, they suffered the worst, because if both parents were performers, then there was absolutely no income coming into that family household. But our artists, appreciate them. They are the ones that really suffered so much. They were completely blindsided. Anyway, for me and my kids, we loved having 3 months off together. We went to the park every day. We ate lunch outdoors. We spent every day walking. We did well as a family, and it was a really good time to discuss with the kids, how do you handle a pandemic? What do you think is important? What food do we try to fill our refrigerator with? When do we start looking at eating the food that we're putting in our pantry? It's a really great way for them to realize how they might handle something like that when they're grown up, and I hope I set a good example for them. My daughter, who was starting high school, she did struggle starting high school and only being online, and that was a little bit of a difficult time for her. Love this station. Love everything that it offers. Thank you so much.
Thank you for that call and for the work that you do to keep all of our teeth clean and healthy, right? During that call, a lot of discussions, a lot of topics were covered, but let's bring in Andrew Woods right now with the UNLV Center for Business and Economic Research. She touched a little bit on the economic situation that COVID left a lot of us in. What do you remember, early memories of COVID's impact on the economy, and what are we continuing to face as a result of the pandemic?
Well, Joe and Amber, thanks for having me on today. And going off of what Brian originally said about how COVID's still here, we're just experiencing it differently. That's the same is true for the economy. When we go back and think about, those early days in March of 2020, at first we thought it might be a few days, a few weeks, and then it turned into months. And we saw that just here in Nevada, our unemployment rate skyrocketed up to 29% statewide. Just here in but if you go to Southern Nevada, it was 34%. So 1 in 3 workers was unemployed. The Las Vegas Strip was shut down, right? We had basically no visitors coming through the airport or driving in from Southern California, and our economy came pretty close to a screeching halt, which is, as an economist, something terrifying to see. It's not something you dream of, except maybe in the movies. So it was at the time very scary to see. Fortunately, since then, we've rebounded much faster than I think we anticipated. But we still see the scars in the economy since then. The fastest growing industries we've seen since the pandemic in terms of employment have been transportation, warehousing, healthcare, as well as construction. For leisure and hospitality, they only regained their full employment levels from 2019, just early last year. Now, what's interesting about especially leisure and hospitality is that food and accommodation type jobs, so those are starting in kitchens or running hotels, they actually decreased. They're lower than they were in 2019, but entertainment jobs have backfilled it. So this switch to the sports economy we can see as an effect in our workforce, which here in Southern Nevada, 1 in 4 jobs is tied to leisure and hospitality. For the state, it's 1 in 5. And we've seen also a burst of entrepreneurial type activity since the pandemic. So yes, people, it was awful what happened, and there are definitely scars still in the economy. We can talk about inflation, right, and all those concerns. But just also what's interesting, we've been doing some research on 1 in 5 businesses that are operating today started during the pandemic too.
Well, and you did bring up inflation. You say we've rebounded, but I think a lot of listeners out there are thinking everything is still so expensive. How can the economy be good when I can't afford groceries I used to easily be able to afford? How do you respond to that? Is it hard to get that message through to people?
Well, I experience it too. I go to the grocery store and I see the price of eggs right now, which is not necessarily because of the pandemic, because of bird flu, but another type of virus that's out there. It is a huge concern. We saw that inflation at one point in 2022 peaked at 9%. We had the inflation numbers today that were much cooler. A lot of what the concerns we see is less now inflation. Affordability is the concern. So it's not so much about the price increases. It's about whether we can afford kind of the lifestyle, and also can we just afford the basics now? Can we afford homes, cars, food, taking care of our families? And some of that has been mitigated more recently. It just takes time to feel it in the economy because real wages have gone up in most industries. Particularly leisure and hospitality has seen the largest increase in wages because it was hard to get people. People didn't necessarily want to go back and work in leisure and hospitality, so they had to raise wages. And we can see that they've outpaced inflation, but the cost of living is still much higher. There's also a lot of things about Nevada's market in terms of costs that make it very unique. For example, we get a lot of the population increases come from California, and they have a very different kind of willingness to pay for things versus the average Nevadan and the average Nevada family. And that's kind of created two economies for especially Southern Nevada. So for some, this seems like a discount. For the others that have been living here before the pandemic, things seem much more expensive.
You talked about, so many jobs are reliant upon gaming, the convention industry. After 9/11 happened, after the Great Recession, and after the pandemic, everybody talked about diversification of the economy, the importance of that. After those major events, 25 years ago, and then in 2008, and now this, that diversification hasn't really happened, or hasn't happened maybe as quickly, or in large part in a big enough way. Do you see it happening here? I mean, are people actually talking about the real need to do that? Or once the economy gets better, do people just tend to forget about it and go back to what they were doing?
Joe, you know I love this question because we've talked about it before. And the Center for Business and Economic Research, this is one of our primary focuses, is can we diversify the economy in Southern Nevada? We do support leisure and hospitality. Sports has had a huge impact on our economy. You can see that. Yes, it has diversified. Our economy has diversified a bit, but not quite at what we would say makes us more recession-proof, which is still keeps us up at night. In particular areas that we've seen the diversification or kind of new industries move in is some in manufacturing, some in IT, and then also healthcare. And we're very bullish about talking about how healthcare is going to continue to grow. It is right now the third largest industry. It will be the second largest industry in Nevada and in Southern Nevada in the next 2 years. It just the amount of demand there continues to propel the employment opportunities and the amount of business opportunities for the state and for Southern Nevada. So we've seen that increase. We've also seen, even with the entertainment economy and sports, kind of spin off of new businesses, particularly coaching facilities. So for not talking about professional sports, but amateur sports, the number of small businesses that are now doing coaching for different sports from lacrosse to football to basketball to gymnastics has increased 160% in the last 10 years. And a lot of that spike came after we started bringing in professional sports, because parents, and even if you're it's not just for your kids, it's also the amount of adults now playing amateur sports, and that's increased then the demand, which also then increases the amount of sports physicians we also need. So we see some of those spinoffs too from the entertainment economy.
Oh, interesting.
Dan Ficalora, I want to bring in you now with Bridge Counseling Services, and we've talked about the grief that people have experienced as a result of COVID, but what about the anger that people have felt over businesses being closed, over the impact to their businesses? Joe, you told me a story about going to a local bar, and instead of that person being happy that the bar was back open, they were really mad that it had been shut down in the first place.
The bartender infuriated, screaming about the governor and the closure of businesses.
There's a lot of anger, I think, post-COVID.
And, hearing Brian talk about, the distrust and the anger that he experienced for his field too is just, irritability, fear, avoidance, hypervigilance. These can all be attributed to trauma and anxiety, right? These are common symptoms that people experience when they're dealing with that uncertainty, when they have this perception of something bad's going to happen in the future. We feel that in a physical form, but also mentally, and it comes out in that fear, anger, irritability, and that really hypervigilance and sometimes paranoia about what's going on. And you have people getting in fights at Costco about having to wear a mask. We have a lot of people that have anxiety about wearing a mask in the first place and then feel like they're isolated from society, and then that can make them feel angry as well. So a very common occurrence that I experienced during the pandemic, and people are just now starting to get back to their new normal. But some of them hold a grudge and are still experiencing that anxiety and that irritability of, I was mistreated during this period of time, and it really impacts how they participate in society.
And are they coming to you seeking services?
I don't know that everyone always has that level of insight, right? They usually end up coming in for one reason or another, oftentimes for a substance use issue that has presented itself, because a lot of times when we're feeling that level of anxiety and anger, we might go to drugs and alcohol. And so they come in for that particular issue. Someone in their life has told them that they have a problem with substances and now they need help. And then we start peeling back the layers and realizing there's a lot of anger, there's a lot of resentment, there's a lot of anxiety and trauma that's below that outward behavior that everyone else is noticing.
What about those people who got in arguments over masks or vaccinations with family, loved ones, friends? I personally had that experience with a family member, and we didn't talk for a year. Are people coming to you? I mean, how do you bridge that? We eventually bridged it. It's a long story about how that happened, but is there a surefire way to mend, to heal, to bridge that divide?
It's going to be different for every person, but at the end of the day, we break it down to what are your core values? What is most important to you? And if family is a core value for you, that's very important and something that you want to foster in your life and in your lifestyle. Is that more important than your commitment to not wearing a mask, your political beliefs, or any other kind of strongly held belief that's making you irritable, angry, or wanting to distance yourself from your loved ones? And we usually just prioritize what is most important and work towards getting more towards your ideal self. Another thing that's really happened, though, is when we got isolated, and especially in the kids and younger, younger adults, we all withdrew to social media. And this, that's a completely different topic. We could have a whole nother show on the impacts of social media on mental health. But none of it's good. Very few studies have come out showing that social media is good for your mental health. And we've seen that misinformation and living in that bubble of information that you're exposed to can often lead to hardening these viewpoints, these irritabilities, these grudges, and that can be really hard to deal with in therapy as well.
We want to hear from you. Please call 702-258-3552. You can also email son@knpr.org. We want to know how COVID impacted you, but we also want to know if you have questions for our panel of experts. In fact, we do have a call from Eric from Henderson. He does have a question for our guests about the state of health under the current administration. Can we get to that call? Eric,
Hello?
Are you there?
Yes, I'm here. Sorry.
Go ahead with your
hello.
question.
Thanks for taking my call. I lost my father-in-law during the COVID, so I understand. He died alone because we couldn't visit him in the hospital and all that. So it's just a terrible thing. And my question is, with all the misinformation, and the first caller kind of touched on this with who's running the country now and the Health and Human Services Secretary and what his beliefs are. I was wondering if any of the panelists are worried about the state that we're in now, and if something like this happened again, are we prepared? Are we going to be able to handle it? That's basically my question, is if there's any concerns they might have about what would happen if this, happened again.
Brian, I think that's for the epidemiologist, right, Brian?
So the night of the election, I taught class, and when I talked to my class, I told them no matter who gets elected tonight, the public health problems that we're going to face tomorrow are going to be the same as they are today. The person in charge doesn't change that. We still have the same challenges. We have the same issues. I've worked under Republican administrations. I've worked under Democrat administrations, and there are things that I've liked in any of those, and there's things that I've disliked. No matter who we put in there, there are going to be things that we disagree with. So there will always be challenges. The focus of public health is to improve the health of the population, and we're going to find a way to do that no matter who's in charge. The person in charge is going to present different difficulties depending what they believe, but it's not something we can just simply put our hands up and say we can't deal with it. There are going to be particular challenges. We've heard about vaccination and some of those issues right now, but I'm sure there'll be other things that are positive for public health. So it's working within the administration and continuing to move forward to improve the health of the population. And if another pandemic occurs, we have tens of thousands of public health people around the country that do this no matter who's in the White House, and they will continue to do this no matter who gets elected in 4 years.
Dan Ficalora, you wanted to add something.
Yeah, I would say one of the silver linings that came out of the pandemic was actually an increased awareness of mental health and behavioral health as being part of your physical health, and gaining equal footing with what we do with seeing our doctor every day, trying to get your therapist into the realm of wellness as well. So we've seen an increase in awareness, an increase in demand for people wanting to get help and getting help on their own instead of being forced to get help. So that's been really positive. But to what Andrew was speaking about the increase in the healthcare industry, we've actually seen that the behavioral health workforce has had a real struggle to keep up with demand. Really hard to have enough qualified providers, especially in Nevada, to meet the demand for behavioral health. And there's been a repositioning of, because so many practitioners went to telehealth and started seeing people from their home or seeing people online, it's harder to get those practitioners back into community behavioral health clinics because the pandemic more adversely affected people of color, people of lower socioeconomic status, children, women, who are the population that are more likely to access behavioral health from a community center and not totally served by telehealth or online therapy centers that have become pretty popular.
And joining us now to talk a little bit more about what it was like to be a physician during the pandemic, Dr. Robert Mull from UMC. Welcome to the program.
Good morning. Good morning.
Morning. Go ahead. Talk about your experience.
Yeah, I had COVID when it was first known to be COVID. Left me with feeling tired most of the time. Didn't think really much about it. And then so many people became ill and so many people unfortunately passed away in Nevada. And UMC opened a COVID clinic on Rancho at one of the quick cares, and I was fortunate enough to be able to provide care for over a year with literally hundreds and hundreds of people who had acute COVID with issues, plus long-term COVID, and would refer them to multiple specialties. After the year of the COVID clinic, I was walking to a seminar at UMC, and I said, "Boy, I'm kind of tired." So I kind of slept through the whole seminar, and then I walked over to CVS Pharmacy, got a COVID test, and I was positive again. And then I started on the medicines that were available, which was Paxlovid. The first time I got COVID, I got immuno infusion plus some other unusual medication. And then I did well and I've been at UMC since 1984. And so I had no further issues, a bit disabled due to an unfortunate little guy attacking me at the mental health at UMC. So I was on kind of leave and doing low duties. And so I got back doing a quick care, which we started in 1988. And then, lo and behold, in December of 2023, I got COVID again.
Wow.
Fully vaccinated, everything. Shingles shots, flu shots, COVID, got it again.
Hey, Dr. Ball, Dr. Ball, I wanted to ask you what it was like to treat patients at this time. I mean, was it a scary situation for you?
No, it was just something you do. It's something. No, it's not scary. I was mainly scared that with clients who had insurance, and UMC, of course, sees everybody with or without insurance, that they would not receive the attention that was needed by subspecialists, pulmonary, gastroenterology, behavioral health science, neurology, all these specialties, ENT, that they would not take these chronic COVID individuals seriously. But fortunately, that didn't really happen. I'm still getting a lot of people calling in. I'm doing telemed at UMC now. They will see my name and they say, "Hey, you treated me for COVID. I'm doing so well." It wasn't scary. It was just your duty. You don't get scared. You try to take precautions, but regardless of the precautions, I got COVID 3 times, so it wasn't scary at all.
Well, Dr. Mull, thank you so much for that call and talking about your experience having COVID and having treated people who were infected.
Megan Rauch, Griffard, let's bring you back in now, the professor of educational policy at UNLV, and I want to know what you have been nodding your head in agreement about when we've heard from various callers as well as from the experts on this panel.
Yeah, so I think one of the things that's really stood out to me is like we had the call from the mom in Summerlin who said it was a really good experience to bond with her kids because they were home for 3 months. I would say that in our extremely diverse Southern Nevada population, both in terms of demographics but also in terms of socioeconomics, I would say that probably their experience was more of the exception rather than the rule, especially in our urban centers. We know that there were people living in very close quarters and limited access to green spaces. So those opportunities to get outside and go for walks weren't necessarily there for everyone. And when school was closed, particularly if you didn't have a parent who was still working, who was home, who either had to go to work or was maybe out looking for work, or just not able to access the online education that was available to students at that time, could be really stressful. We had a lot of students who were responsible for younger siblings, and we know that for students from economically disadvantaged backgrounds, learning loss when school is not in session, just even typically over the summer, is much higher than for those families in more affluent areas. And so that's just something to be mindful of, is that for a lot of families, it was not a good time. It was a scary time, and just being mindful that we're all still carrying that with us.
Yeah. And how long does it take for these students to catch up? Is that going to happen? I see a lot of sadness in parents' faces when I talk to them about COVID and the loss that these children experience by being out of school. What do you say to them? Do they ever get these years back? Do they catch up?
It's hard for me to give a definitive answer. I think, like when we talked on the phone last week, Amber, I had mentioned that this is sort of like the lost generation that came back after World War I. We're in that shell shock, especially if you're a young kid and suddenly, you're not in school, you're not around your friends, you're not around your teachers, you're maybe not learning anything. Your parents are stressed. You may have family members who are getting sick. There's concerns about being able to afford food, afford your home. All of those things, they don't just, go away. It may lessen over time, but we also see that children who are, especially younger kids, lost really crucial developmental opportunities from not being in school for that time. So I think we're going to be dealing with the impact of COVID on education for a long time. I would anticipate that dropout rates in the future are also going to increase. So that's something to keep in mind. We're going to be seeing this for a long time.
And that's it. We're gonna wrap this up. I really want to thank our guests. This is a very important conversation, and I hope people listening learn from it. And I hope everybody who was involved and is still with us after COVID has, have learned from it as well. And we hope it never happens again. Andrew Woods is the director of the UNLV Center for Business and Economic Research. Brian Labus is a UNLV epidemiologist. Megan Rauch Griffard is a UNLV professor of educational policy, and Dan Ficalora is with Bridge Counseling Services. All of you, thank you so much.
Thanks for having me.
Thank you.
And thanks to those who called and wrote in. As usual, your questions and your comments really, really do make this show come together. I want to thank you, and join us tomorrow when we are going to be talking with the new director of Nevada's, Southern Nevada's Health District. And Amber, I really want to thank you so much for joining us. This is a great collaboration.
I appreciate you having me. I didn't realize we were running out of time because that was a great discussion.
Yeah.
Thank you for having me.
And thanks to all of your staff. This is State of Nevada.